So if you suspect your patient to have a potential spinal injury, certainly injuries around the neck are the ones we're most concerned of, it's very important that we maintain neutral alignment on the patient, and we maintain that until we have the emergency services arrive. Now, you've got to consider on your arrival to your patient, should they be laying on the floor or be sat up in a car, how you approach them. If you approach them from the side and ask them to say your name, see if they're conscious or not, it may encourage them to look round to the left and right, encouraging movement of the neck. So try and approach from forwards on, explain who you are. I'm Richard, I'm here to help you, look after you, and try and make eye contact with them. Ask them also to keep looking forward. You then want to, with both hands, hold on gently to the side of the head, reassuring them all the time. Now, my current position, I can support them here and hold that head. However, it's not ideal, and I could be doing this for a good 20 to 30 minutes in some situations, and it's very easy to move around. So try and get your body nice and close. If you place your elbows, for example, onto the floor, you will brace your arms and you can brace that head like so. So with your patient, you may have them in a good position. You've got good support, looking after that cervical spine, the neck, making sure we don't increase any risks to injury for that neck. However, we may have issues with the airway. There could be vomit, teeth, blood within that oral cavity there, increasing their risk of hypoxic events or lack of oxygen. So ideally, we need to get these people laying onto their lateral side to make sure we can maintain a nice clear airway all the time. People are very fearful when it comes to moving patients with a potential neck injury onto their side in case they aggravate those injuries. However, it is very important that we maintain good, clear airways. So what we're going to do is I'm going to maintain the patient's neck and C-spine, constantly reassure my patient, and I will remain in charge because I have control of the head at all the time. I'm going to ask Neil to lean across the patient, taking good support, and on my call we're going to gently roll the patient onto her right hand side, ready to roll and roll. And working as a team, the patient will go over and the neck will stay nice and in line with the rest of the body.
So we've got our patient now. We're still concerned about a neck or a back injury, but we're on our own, but we're fearful that she may vomit, so we do need to get her on our side. And lots of people, as we said earlier, very fearful of moving people in case they're going to make the injury worse. However, that airway is our #1 priority. So if you're on your own, if you've got no other option, then it may be that you have to get them into a recovery position. If that is doing your high five position and doing it how you remembered, that's fine. If you forget all the steps, just remember, get them onto their side and open that airway. This is our #1 priority, so if we have to get them on the side and open up that airway, that's what we've got to do.